but still why I'm getting bad breath. What's relatives nearby and just we will harbors microorganisms and that will ultimately cause bad breath. There is only one solution. This brushing technique, what I toothbrush, never take hard toothbrush. What harder, and I'll take around 3 to 4 minutes, and you don't have to forget this tooth model, modified Bass method of toothbrushing. The main area of focus is, but you are damaging your tooth enamel. Angulation. How should be our toothbrush in our mouth on the teeth surface? So our toothbrush is, it sometimes if I do miss, hello everyone, it's me, Dr. Ritu. So many times I get complaints from a patient that, ma'am, I don't know, I'm doing brushing twice daily, but still why I'm getting bad breath. What's the reason behind this? How I can get rid of it? So today, if you have similar issues, don't skip any part of this video and just be with me till the end. You will get your solutions. You don't have to go through any other video, and still you find that you didn't got your solutions, you can ping me in comment sections. I will reply you for sure. So basic reason behind this is that you are brushing twice daily but still getting bad breath. So that might be because of some tooth decay or calculus deposits in your mouth. Why this happens? Because you are doing brushing twice daily but still you are getting decayed tooth and calculus deposits. It's because we are not doing brushing properly. If you have these kind of issues, then just treat it by going to a nearby dentist where you find they can treat it perfectly. Just get a review from your friends, relatives nearby, and just visit and get it treated, because until unless you won't treat this tooth decay and calculus deposits, there will what happens, these tooth decayed part, these harbors lots of food deposits. If you clean teeth, you can clean easily from this smooth surface of the tooth, but you can't be able to clean perfectly from those areas, those decayed teeth. So if there is continuous deposits, it will irritate that area, it will harbors microorganisms, and that will ultimately cause bad breath. There is only one solution for that tooth decay and calculus is you have to visit dentist. But if you have perfectly teeth, you feel like you don't have any kinds of deposits or tooth decay, still you are having bad breath, you are doing brushing also twice, but still bad breath, then just follow this brushing technique what I'm going to explain you in this video in detail. Don't skip any part. So proper brushing technique for healthy teeth and gum is modified Bass method of toothbrushing. For this, what you have to do is you have to take soft or medium toothbrush, never take hard toothbrush. What we follow usually, let's understand that I'm not dentist. In that case, what I will do, I will just take hard toothbrush and I will try to clean my tooth harder, and I will think that if I will clean harder, then it will clean perfectly and I will get rid of bad breath. No, that's not the proper way. What you have to do is take softer toothbrush or medium, it's okay, but never use hard, and you have to follow proper brushing technique for it will take around 3 to 4 minutes, and you don't have to forget cleaning your tongue. Tongue cleaning is also very important. Tongue coats what we eat, that deposits on our tongue, that also cause bad breath. So don't miss cleaning your tongue. Now let's understand now on this tooth model, modified Bass method of toothbrushing. This is also called intrasulcular method. This is gingival sulcus. Our main area of focus is this and this. If you are doing scrubbing method of toothbrushing, then anyway you are going to clean this also, but you are damaging your tooth enamel also. So what we are doing is, in this modified Bass method of toothbrushing, we are cleaning this oral cavity as a whole. We are doing proper cleaning. We are not leaving any kind of food debris in any part of our tooth, so that it will cause any kind of bad breath. So now let's start with brushing angulation. How should be our toothbrush in our mouth on the teeth surface? So this is brush head. Brush head should be parallel to the floor of the mouth. This is floor. This is brush head. So this one is floor of the mouth and this is brush head. It should be parallel to the floor of the mouth. So open little, and this is toothbrush bristles tip. Toothbrush's tip should be into the gingival sulcus. This is gingival. This one is gingival sulcus. Our main area of focus is this, and toothbrush should be 45 degree to the long axis of the tooth. This is long axis of the tooth. So how should be the angulations? Let's see. This is the long axis of the tooth, and this is long axis of the tooth, and our toothbrush is like this. This. So this is proper. How to start tooth brushing? First, we have to start from the most distal part of tooth. First, how much this brush head can accommodate is, it hardly can accommodate 3 to 4 teeth. So first we should start from the most distal part of the tooth, upper, this one, and then just do brushing 90 to 20 times in the circular vibratory motions. Don't dislodge this tip from this sulcus area when you are doing motions 90 to 20 times. If you will dislodge, then it won't be able to clean effectively. So try. Initially you might feel it's a little difficult to master, but it's okay, you will learn slowly. So what you have to do is keep this toothbrush like this and do brush 90 to 20 times. And what happens at the end of 90 to 20 times, so what you have to do is just move your bristles like this, so that what will happen, whatever will be the dislodged debris, it will come down and it will leave the tooth surface. So once if you will rinse your mouth, it will clean easily. Next, what you have to do is, after cleaning 3 to 4 tooth, you have to move to the next, lift the toothbrush and move to the next 3 to 4 tooth, and just follow same procedures like this. Like this only you have to do on this surface and this, or inside also, on this area also you have to follow same procedures. On this area also you have to follow same. But what for this upper anteriors and lower anteriors, what will happen if you will keep your bristles like this? It won't adapt. It won't adapt properly on this tooth surface. If it's not adapting, how you think it will clean? So in that case, what we have to do is just place your toothbrush vertically like this, and then do only on one teeth at a time. Do this vertical circular vibratory motions 90 to 20 times, and then pull down. So again, whatever debris will be there, it will cleanse it out. And for this down also, what you have to do, lift toothbrush vertically and engage your toothbrush bristles tip on the gingival sulcus. Do circular vibratory motions 90 to 20 times and then lift. Now what on this occlusal surface? Occlusal surface, again you have to do once on 3 tooth. Just engage your toothbrush tip into the pits and fissures. There is lots of minor lining, tree-like lining on the tooth surface, that is called pits and fissures. That area is very susceptible for the tooth decay and caries, whatever. So what you have to do is press your toothbrush bristles tip firmly on this surface like this, and then give circular vibratory motions 90 to 20 times, and then lift your toothbrush and again go ahead. Like this also you need to follow on this also. Now, same. The fourth part of toothbrushing, what we all miss most of the time, as a dentist, even I can say that sometimes if I do miss, when I do in hurry, that is this one, this part of toothbrush, this part of the tooth, this one. So for this part, what you have to do is open your mouth little wide, and then place your tooth like this, and place your toothbrush behind this back portion of the tooth, and move left and right or back and forth, whatever you feel like. You have to rub on this back surface of the tooth, on this also, and this also. This is very important area of the tooth of oral cavity, where we miss most of the time and where food lodgement happens. If you are not cleaning here and you will try to rinsing your mouth with normal water also, then also it won't clean. So now next part is you have to do proper tongue cleaning. Tongue cleaning is also very important. And at the end, if you feel like you have still any issues, and you are you are not satisfied, or you feel like still you have bad breath, what you can do is you can just put in a half glass of water 1 teaspoon salt, and just gargle after brushing, so that you will feel a little more fresh. In initial days you can try for 1 week. After that you will feel okay, fine. But still in between, if you are feeling that you are not feeling okay, there is still bad breath, then you can try this method. It will work perfectly. And most this important of this saltwater most important part of this saltwater gargle is it's easily available in our home. So it's not like we have to go and buy. Just you can try at your home anytime without any expenses. Still, if you have any queries, you can ask me in comment sections. And thank you so much for being with me till the end. If you have any queries related to dental health, you can ask me. You can visit my website dentistmama.com for any queries, or if you want to visit, just go there and check it out. Thank you.